Potentials of Vamana Karma, a clinical approach. It's now proud privilege and distinct honor to introduce today's eminent resource person, Professor Dr. Kiran M. Goud, sir. Sir completed his BMS from Tarnath Government Ayurveda Medical College and Hospital, Ballari, and subsequently obtained his MD in Kaya Chikitsa from Government Ayurveda Medical College, Mysore. With an illustrious professional journey spanning more than 3 decades, Sir is presently serving as a principal professor in the Department of Panchakarma and Chief Medical Officer at Sri Kalabhaireshwara Swami Medical College, Hospital and Research Center, Bangalore. Sir has held several prestigious academic responsibilities, including serving as an undergraduate and postgraduate examiner, PhD evaluator, Board of Studies member, Institutional Ethical Committee member, RGHS Committee member, and subject expert for Ayurveda curriculum development. His scholarly contributions are equally remarkable. Sir has authored more than 30 research publications in reputed national and international journals and has been associated with several CCRAs and RGHS research projects, reflecting his unwavering commitment to evidence-based Ayurveda and academic excellence. Sir's unwavering dedication to Ayurveda education, clinical excellence, research, and mentorship has inspired countless students and professionals across the country. His vast experience and profound understanding of Panchakarma make him one of the most respected academicians in the field. Sir, your presence today is a matter of great honor and privilege for all of us. We sincerely thank you for accepting our invitation despite your busy schedule. We are eagerly looking forward to learn from your invaluable knowledge, extensive clinical experience. On behalf of Department of Panchakarma, TGNC Ballari, I extend our heartfelt welcome and respectful request you to kindly deliver a lecture on therapeutic potentials of Vamana Karma, a clinical approach. With these few words, I request our esteemed speaker to kindly commence the session. Before we begin, I kindly request all participants to keep their microphone muted throughout the session. Participants are requested to post their queries in the chat box within first 10 minutes, which will be addressed by the speaker at the end of the session. With these words, I now have the honor of inviting our distinguished speaker, Professor Dr. Kiran M. Goud, sir, to kindly commence the session. Over to you, sir.
Namaste to all.
Namaste, sir.
Let me try to share this. Yeah. Is it visible?
Yes, sir. It's visible, sir.
Yeah. Seeking the blessings of my beloved teacher, Dr. M. Ishwareddy, sir. My pranams and namastes to Janaki madam, Dr. Rajshekar Ganiger, my good friend, Dr. Santosh Edhalli, Dr. Hugar, Dr. Shilpa. Thank you for giving me this opportunity to share my thoughts. Yeah, I probably will be taking you all to whatever I have learned through Dr. Ishwareddy, sir. Maybe when we joined in 1989-90, you all can just imagine. 1989-90, it is something like, if you have heard a book called as Nakanda Germany by Ho Srinivasayya. He was a Gandhian. This book was given a Sahitya Academy prize, and it was also incorporated in the school curriculum. Nakanda Germany. How he viewed Germany. In the similar way, probably I will now be taking you all through Nakanda Vamana. How I have seen Vamana when I was a student under Dr. Ishwareddy, sir. Way back in 89-90, we did not have a lab there in Ballari. Just imagine, we did not have a small lab to do a HB, etc. Or we did not have any MOT also, where we could do dressing, etc. whenever any patient comes over or has any injury, etc. So those were the days when under Dr. Ishwar Reddy sir, we were able to conduct and learn Vamana. Okay. Now, Dr. Santosh has asked me to deliberate or to give my thoughts on therapeutic potential of Vamana Karma, a clinical approach. So maybe most of it will be what we have learned under Dr. Ishwar Reddy sir, and maybe some of them might be my contributions. First, therapeutic potential. Therapeutic potential, it simply means how good a treatment or medicine could be at fixing a health problem. Under those, does it work? Is it safe? Is it easy to use? Any procedure should be. Am I audible?
Yes, sir.
Yeah. Any therapeutic potential of any treatment should be under 3 headings. Does it work? Is it safe? Is it easy to use? Only then probably we will be able to understand what a therapeutic potential of Vamana Karma and etc. are. Now, when I look at clinical utilization of Vamana Karma in my college since 2021 to 2025, it is only 1.2% of all the Panchakarmas that are performed. I'm not talking about all other Katibastis or Janubastis or any other Bahir Parvata Chikitsa. This is only Panchakarma procedures. In the last 5 years, 86,923 Panchakarma procedures were performed in our institution. Among them, Vamana, we have performed only 1,027 procedures. That is 1.25%. Only 1 in every 85 procedures was Vamana. Basti, of course, was 54 times more frequently than Vamana. Nasya 22 times more frequently, Virechana 8 times more frequently. A similar decline in therapeutic emesis in Tufa is seen in traditional Chinese medicine also. When I went through the articles, a similar decline in choosing of therapeutic emesis in Tufa, traditional Chinese medicine is also seen. These findings suggest a limited role for Vamana in routine institutional practice. And I don't know why Santosh asked me to deliberate on Vamana with only 1.2% of the total Panchakarma procedures in my institution. I would like to first introspect and see why Vamana is chosen less. Let us see. Maybe the major contributing factors are, it is time intensive. Approximately it takes around 3 to 4 hours. All of you agree, I think. And I have heard that it is only postgraduates who are in this webinar. So approximately 3 to 4 hours, including monitoring. That is right from the time in the morning when the patient comes and we take him to Abhyanga Sveda. From there, and the preparation of kashayas or fantas, boiling of milk, etc. From there till the Panchakarma, it takes around 3 to 4 hours. High manpower, minimum 4 trained personnel per patient is required. Resource intensive, dedicated Panchakarma facility and physician supervision is required, unlike Virechana. Potential risks such as dehydration, electrolyte imbalance, aspiration, cardiac strain in susceptible patients. These are all the potential risks. That is why probably some of the physicians do not choose Vamana. It requires emergency preparedness, such as IV fluids, oxygen monitoring, and referral pathways. See, this is very important. If you all don't have referral pathways for managing emergency conditions, then probably you will have that inhibition to take any patients for Vamana. Limited availability of standardized Vamana formulations, unlike Trivruta Valeha, etc., which are all available ready-made in prescriptions. Vamana, probably we do not have ready-made formulations. So probably this is one of those contributing factors. Many private centers prefer less invasive procedures for operational, safety, and medical legal reasons. Consequently, Vamana is performed predominantly in tertiary Ayurveda teaching hospitals. Whenever I talk to some of my students who have post-graduated from my institutions, who are practicing Panchakarma in their private therapy centers, Karma centers, when I ask them, they say they hardly practice Vamana for these reasons. This is what I have collected. And when I spoke to some of my friends in CCRAS, the feedback from CCRAS is there are around 10 institutions, CCRS institutions all over India where Vamana is done. And Vamana probably somewhere around maybe in between 40 and 50 Vamanas are performed in a year in CCRS, Central Council for Research in Ayurveda Systems, maybe Chiruturti, Bangalore, etc., etc. And you all can understand that probably there must be some other strong reasons also contributing why Vamana, preference for Vamana is coming down gradually. Maybe some of the other contributing factors are advances in modern medicines have reduced situations where Vamana is considered indispensable. Earlier, maybe 30 years back, when I was a student, when some of these were not that frequently seen, maybe nebulizations, etc., were not frequently seen, then probably Vamana was indispensable for some of the diseases where there was constrictive pathology, where we had to go for Vamana to eliminate kapha doshas such that the patient gets that ease of breathing. Now, modern therapies often provide effective, safer, and more convenient alternatives. Contemporary practice has shifted Vamana from a routine procedure to a selective intervention. It has now become a very selective intervention. As you see, SKMC data reflects low utilization, not lack of therapeutic efficacy. I would like to repeat, it only reflects low utilization, not lack of therapeutic efficacy. Vamana is very, very, very effective in some of the strong indications that Vamana is wherever we are using it. It is very, very useful. But what I'm trying to give you all this data is about what are the reasons for low utilization. The data reflects that. Reduced utilization is likely multifactorial, clinical, technological, logistical. Logistical, yes, I have heard through many of my friends in Jamnagar and Jaipur or in Delhi. There are my friends there. When I asked them about what is the frequency of Vamana Karma, they said it is coming down. The utilization or the selection of Vamana Karma is become very, very, very less. The major reasons that they say is logistical. Early in the morning, to mobilize 4 of them to come down to conduct Vamana, and maybe especially the paramedical staff, because they do not have any regulations or rules in their hospitals to give day off or something like that. So these are the logistical reasons that they were trying to tell me why Vamana was less frequently suggested. Maybe high quality multi-centric trials are needed to define its role in evidence-based Ayurveda. Vamana is evolving from a broadly applied Panchakarma therapy to a specialized procedure for selected patients and conditions and in selected centers. This is what I feel is now the landscape that is changing towards next. the changes are major advances in disease understanding over the last 3 decades. If we look at the understanding of last 3 decades of disease, scientists look for a specific protein or receptor or gene, that which is misbehaving or causing the disease. And probably through the institutions, we have not made any efforts to understand Vamana as a massive reset switch. If we understand Vamana is now going to work as a massive reset switch for this misbehaving proteins, misbehaving receptors or genes, or for cell signaling pathways, probably if efforts are made in these lines, maybe the landscape may change in future. You can just go through all these reasons. Many conditions once treated with Vamana are now managed with safer, less invasive therapies. Vamana is therefore considered far more selective clinical indications than in the past. In the past, there were much more clinical indications where Vamana was frequently performed rather than these days, because it has become more selective. Next slide. Yeah, with this slight introduction, maybe I will just go through my presentation today. Those days when Dr. Ishwaridi sir taught us, when we came to final years, he used to tell us this: Ayu Kamayamanena Dharmartha Sukha Sadhanam Ayurveda Upadesheshu Videyo Paramadaraha. When he asked about Paramadaraha, we used to tell that all those English translations, etc. But then he quoted this tika and then said, Paramadaraha itihi Pata Utkrishta Yatna Karya, Avabodhana Utkrishta Yatna Karya, Anusthana Utkrishta Yatna Karya. One who has this aptitude of learning, putting more efforts in learning, Utkrishta Yatna Karya, Avabodhana, in understanding, in which context, where, etc., etc., Anusthana, in application. One who is having this aptitude to put Utkrishta Yatna Karya for learning, understanding, and application. So that is where he used to teach us about Vamana Karma those days. And then when he started with Vamana Karma, he used to ask us, how are you going to first post a patient for Vamana? Probably all of you might have read this context, but I would like to just throw little light on that context, where in Charaka Vimanasthana 8/18 there is Tatra Chet Bishak Bishakva Kachit Deva Kalu Puchet Vamana Virechana Astapana Anuvasana Shiro Virechana Kam Prayokta Kamena Bishaja. One who is interested in posting or administering Vamana Virechana Astapana Anuvasana Shiro Virechana, what is he supposed to do? Then he should first know Kati Vidaya Pariksha, how many types of examinations are there available with him. Maybe it is Trivida Pariksha, Chaturvida Pariksha, Dashavida Pariksha, Ashtasthana Parikshas, etc., etc. How many Parikshas? Kati Vidaya Pariksha. And among them, which are the ones that are useful in this patient or in this particular condition? Kati Vidameva Pariksham. How am I supposed to examine this particular patient? Kati Vidameva Pariksham. Kaschit Atra Pariksha Visheshaha. In this particular patient, which is the area of interest, maybe it is respiratory system or GI, which is that particular system? Pranavaha Srotas. If it is Pranavaha Srotas, what are the Dushtilakshanas, etc., etc., etc. Kaschit Atra Pariksha Visheshaha. Katamcha Parikshitavyam. How am I supposed to examine? Whether am I going to use auscultation, or am I going to use percussion, tactile vocal parameters, etc., etc. Katam cha parikshitavyam. Kim prayojanam cha pariksha. What is the use of that pariksha? For example, if I am examining a patient who has come to me with breathing difficulty, when I just go through Prashna Pariksha or any other Pariksha, that which I have opted, or maybe through auscultation, if I am able to understand that this is constrictive pathology and not restrictive pathology, then maybe Kvacha Vamanadinam Pravrutti. If it is a restrictive pathology, Nivrutti, I do not go for Vamana. If it is constrictive pathology, I would like to choose Vamana. Constrictive pathologies are all those where there is the narrowing of the lumen of airflow. Maybe it is a bronchospasm or whatever. Restrictive pathology is whenever you have a case of ascites, and because of ascites, there is this Swachakrutrata happening. So probably Kim Prayojanam cha Pariksha is I am able to understand through these examinations. Whatever examinations I have, what methods of examination I have chosen, etc., etc. Through these examinations, and now I am able to understand that this is constrictive pathology, and hence Vamana can be chosen. It is a restrictive pathology, and hence Vamana cannot be chosen. Kim Prayojanam cha Pariksha, Kvacha Vamanadinam Pravrutti, where I should start going ahead with Vamana, where I should not go choose Vamana, Nivrutti. Pravrutti Nivri Lakshaha Sanyoga Kim Naishtikam, what is the use? And then Kanicha Vamanadinam Beshaja, which are the medicines that will be very useful in this particular condition. If it is a case of Aruchi, Ajirna, if it is a case of Urticaria, if it is a case of Amlapitta, which are the medicines that I am going to choose, or what is the form of the medicine that I have to rely on. All of this is what Charaka says in Vimanasthana. Before you post a patient for Vamana, you are supposed to know how many parikshas are there. Among those parikshas, which are the parikshas that you are going to choose. Then once you choose those parikshas, which are the areas you are going to concentrate on, and once you concentrate on the areas of examination, then how are you going to conduct examination? What is the deduction? What is your final conclusion? And thereby whether you are supposed to choose Vamana or not choose Vamana, though it is a Arha Vyadhi. Shwasa is definitely a Arha Vyadhi, but restrictive pathology Shwasa is definitely not a Arha Vyadhi. A Shwasa resulting because of ascites is definitely restrictive pathologies where the lungs are not able to accommodate. Then in such cases, probably Vamana is not the choice at all. Yes. Now, all of you know Pachanahai, Deepanaihi, Snehestan, Svedes, Chakare, Shodet, Shodaner Kale, Etastannam Yatavala. These are the things that are we are supposed to do in Vamana. Either it is Pachana, Deepana, Snehana, Svedana, then we will have to go for Vamana or Virechana whenever it is Shodana. And where do we conduct Vamanas? The rule is Prabhuta Sleshma Pitta Asramalaha, Samsushta Marutaha, Bruhat Sharira, Balinova. Right. So in Langana, there are three types of Langana: Alpa, Madhyama, and Prabhuta. In Prabhuta Sleshma Malaha, Vamana, Prabhuta Pitta Malaha, Virechana, Samsushta Marutaha, Vamana and Virechana, Bruhat Sharira, Balina. Maybe if the patient is fit, or maybe in Swasthas, we will be choosing Bruhat Sharira Balina. Langhaniya Vishuddhi. These are the conditions. Generally, we choose for Vamana. Now, what is Vamana? Tatra dosharanam urdhobhagam vamanam sangnakam adhobhagam virechanam sangnakam. Ubhayam va sharira mala virechanat virechanam sangnakam lag. Any procedure which has the ability to flush out the doshas through urdhobhaga is Vamana. Adhobhaga virechana. Ubhaya mala. Then it is Vamana. Charaka in Sharirasthana explains about what is Shariramalaha. He says, Tatra malabhutastaye sharirasya bhada karasu. Malas are those components of the body which have the ability to cause cell injury. Malabhutastaye sharirasya bhada karasu. Tadyata, for example, Sharira Chidreshu Upadeha, those which have the ability to narrow the lumen of the blood vessels or whatever, and thereby cause ischemia, so on and so forth. Prutak Janmani, Bahirmukha, Paripakvascha Datavaha, Prakupitascha Vatapittashleshmani, Yecha api Kechit Sharirati Bhavaha Sharirasya Upagatayoho Upavadyate. So all those aspects or physiological parts of the body which can cause cell injury are to be considered as molest. And this is where Vamana is to be chosen if it is Kapha Pradhana, Kapha Sthananugata, Kapha Anubandha. Kaphe Vidadhyatvamanam Sanyogeva Kapha Ulbani. So, kapha, whenever it is kapha pradhana doshas, kapha anubandha doshas, or kapha sthananugata doshas, usually Vamana is the choice. Now, when it comes to application of Vamana, Samanya Vamana Vidhi, you all know the Samanya Purva Karma, Pradhana Karma, Paschat Karma, but probably I would like to throw some light on this Samanya Vamana Vidhi, where we are generally not using some of the aspects of Samanya Vidhi. Though in Samanya Vidhi, Pachana Dipana, Snehapana, till Samyak Nigdha Lakshanas, then Vishramakala, in Vishramakala Abhyanga Sveda, then Kavotleshakara Ahara, then the next day Pradhana Karma, Vamana, etc. is done. This is Samanya Purva Karma. There are some missing points in Samanya Purva Karma. Samanya Vamana brings certain light on those missing points. And Vamana in Vishishta Avastha, such as in Araha Roga and Araha Rogi, in Anaraha Rogi, in Anaraha Roga, in Anaraha Roga and Rogi, related to Paschat Karma and miscellaneous. I will be deliberating in this paper about these things. Vamana in Swastha. All of you all know Samadosha Samagnischa is the very popular statement where we get in Shushruta Sutrasthana about Swastha. And usually in Swastha, in Vamana Rutu, we usually post the patients for Vamana. Now, if it is Samadosha Samagnischa, most of the students, when I ask them the question, so what is, how many of you are Swastha? Please lift your hands. I fail to see 10% of the students confidently lifting their hands because they are under the dilemma whether there is Samadosha, Samagni, Samadhatu, Malakriya, etc. So, for this, Chakrapani states, in Charaka Sutrasthana, 5th chapter, 13th shloka, Chakrapani states, Srushtu Nirvikarattvena Avatishtati iti Swastaha. In Srushti, if there is anything that which is in Nirvikara, then that is called as Swastha. That is, for example, if there is a male patient, is having all the male features, then he is Swastha. Female patient having all the female features, she is Swastha. A horse which is having horse features, it is Swastha. A elephant having elephant features, it is Swastha. Srushtu Nirvikarattvena Avatishtati iti Swastha. Tasya bhavaha swasthya. Its expression is health. There he says, Udvejaka dhatu vaishamya virahita dhatu samyam ityartha. Any avastha, Udvejaka dhatu vaishamya virahita. If there is an avastha called as normal blood sugar levels, fasting normal blood sugar levels, 80 to 120, anything that falls below 80, anything that falls above 120 is said to be vaishamya. Udvejaka dhatu vaishamya. If this is virahita, if it falls in between 80 and 120, this is swasthya. Udvejaka dhatu vaishamya virahita dhatu samyam ityartha. He talks about a normal range. If any person falls in this normal range, then probably he is swastha. So when I ask the same question, now how many of you are swastha? Maybe 100% of the students raise their hands. They will not be having these doubts. So this definition of Chakrapani, Udvejaka dhatu vaishamya virahita dhatu samyam ityartaha, probably when we look at most of the investigations, they have a big range. It may be a simple ESR to CBC, anything like that, they will be having ranges. In on all these ranges, this definition fits. Now, under Swastha, if any person who is Swastha does not subject himself for Vamana Karmas as per the Rutus, then Ashtanga Sangrahakara Sutrasthana in 5th chapter, Roganupadini Adhyaya, labels them as Beshajat Dveshi, and then he says they are at the risk of developing a disease called as Prayashaha Suchirena Beshajat Dveshino Gadaha. These patients are at the risk of developing Atistolya, Agnisadana, Meha, Kusta, and he gives a big list of diseases that these patients are at the risk of developing these diseases, depending upon whatever nidanas they will be exposing themselves to. So probably we will have to understand that a patient who performs or subjects himself for Rutu Shodhana is not at the risk of developing diseases. And is it compulsory for everybody to perform Rutu Shodhana? No. Why? Because in Ashtanga Sangraha Sutrasthana, 4th chapter, 24th shloka tika, he says swasthas are of two types. Dvivido is swastha. These days, we see many people going for walk in the morning, going for gym in the morning, doing aerobics, doing yogas, etc., etc. In all of them, there is no chance of Sanchita dosha. Only when a patient does not, or there are other patients also who do not go for walk, who do not go for gym, who do not follow dinacharyas or any physical activities. In all of them, there is possibility of Sanchita dosha. So he says, Dvivido hi swastaha, Sanchita dosha, asanchita dosha. In Sanchita dosha, there is a need for Vamana, there is a need for Virechana, depending upon whether they are Vata Prakrutis, Pitta Prakrutis, Kapha Prakrutis, as Charaka states in Charaka Vimanasthana 6th chapter, that any Shleshma Prakruti person, if he does not follow the Dinacharyas or Rutacharyas, or he exposes himself for such Kafaja Nidanas, then he is at the risk of developing Kafaja Vyadis. And in them, the first choice of treatment should be Vamana. So, Dvivido Swastaha, Sanchita Doshas, Kapha Pradhana Prakrutis, or Kafanubandha Prakrutis, these persons are more at the risk of developing Sanchita Vamana, Kapha Doshas. So, in those patients, maybe Vamana at least once in a year, if not once in a year, twice in a year, once in 2 years, or at least once in 3 years, yes, maybe there is a need of Vamana. Or else he is always at the risk of the above said diseases such as Srota, Atistolya, Agnisadana, Meha, Kusta. And this is what we are seeing these days, that many of the patients are at the risk of developing this Santarpana Vyadhi, especially the metabolic symptoms. Now, coming back to, I was talking to you all about Samanya Vidhi. What are we missing in this Samanya Vidhi? The day the patient is taken into the Vamana, that is maybe Tastam Purusam Sneha Svedopapannam. The Sneha Sveda is done. On the day of Vamana, the patient is taken to Vamana Kakshan. There, maybe Nisha Suttam Sujirnanam is what Ashtanga Sangrahakara says. But Charaka says, Anupahata Manasam Abhisamiksha. You are supposed to first ascertain Anupahata Manasam Abhisamiksha, that is Ragadveshas. Any of these are not present with the patient. He is not in those nidhanas. When once it is done, Sukoshitam, then Suprajirna Bhaktam, Shirasnatam, Anulipta Gatram, Sragvin. Sragvin is garlanding. Any person should be garlanded first. Anupahata Vastra Samvita. Then this particular part probably is missing these days when we practice Vamana. Anupahata Vastra Samvita means the patient should have draped with a cloth which is not having a break in between, something like a dhoti, something like a sari, not pant and shirt, not churidars, etc. Anupahata Vastra Samvita. Anupahata Vastra Samvita, maybe Mangalacharana, it is having a similar thing. When we asked our teacher, he said, when we sit for Homa, we usually go for Raksha, the wearing of Raksha to our ring finger. That is usually done with Darba. He said, why is it worn? And then he said, see, if you take two magnets, they usually attract each other. But when you take this Darba, you burn this Darba in and keep them in between these magnets, it repels. It repels the magnetic field. Similarly, this Anupata Vastra Samvita has the ability to repel those microbes which have the ability to cross the blood-brain barrier and cross Amanusha Upasarga. If you look at Shushruta Samhita Uttaratantra, 60th chapter, Dalana says, after Mutra Kruchra, this chapter called as Amanusha Upasarga is explained. And the reason for explaining it there, he says, Mutra Kruchre, after Mutra Kruchra, there is increased frequency of micturation. And because there is increased frequency of micturation, there is asamyak achamanaha or asaucha. Because of asamyak achamana and asaucha, there is every chance of the person coming across those microbes which have the ability to cross the blood-brain barrier and cause neurological infections. Similarly, when we are conducting Vamana, for a transient period, the body is compromised that there is every chance of these microbes crossing the blood-brain barrier and causing neurological infections. And hence, if there is Anupata Vastra Samveta and this garland, then it prevents those microbes from entering and causing such things. So, if you ask the patient to drape a dhoti, which is continuous without break, and a sari without break, any vastras should be draped which are not having any break and should be continuous. That is what is the meaning of Anupata Vastra Samvita. And then he goes on telling you'll have to seek blessings from whomever you have faith in, whichever power you have faith in, you'll have to seek the blessings of those powers to guard you. And then he says, Ishta Nakshatra. Ishta Nakshatra here is, if you look at the Chakrapani's Tika, the Ishta Nakshatra, he says, Yaduktam Jyotishye, Pushya, Hasta, Tata, Jeshta, Rohini, Shravana, Ashwini, Swati, Saumya, Cha, Beshaje, Kuryat, Na Anyatra Varjit. That is, among the 27 nakshatras, if you are trying to perform Vamana, then if you do not want to come across Vyapats, probably choose these nakshatras. Probably choose these nakshatras. Among these nakshatras, Pushya, Hasta, and Ashwini are said to be Kshipra nakshatras or Lagu nakshatras. Rohini and Margashira are said to be Mrudu nakshatras. Swati and Shravana are said to be Chara nakshatras. Jeshta is said to be Tiksha nakshatra. So, when we asked about the significance of these nakshatras, my teacher, Dr. Ishwareddy sir, used to tell, just like the Samanya Vamana Karma Vidhi, where you choose Purva Karmas as Pachana Deepana, or you choose Snehapana, Svedana, and then conduct Vamana or Virechana. This is Samanya Vidhi. In Vishishta Vidhis, you will be very specific about choosing Rukshana, etc. In Samanya Vamana Vidhi, Ishta Nakshatra is these 8. Among the 27 nakshatras, you can definitely perform Vamana among these 8. And these are said to be good for conducting Vamana. But in case if you want to perform Vamana in diseases which are having deep-seated amadoshas or deep-seated doshas, dhatu leena doshas, maybe diseases such as psoriasis, etc., then Jyeshtha Nakshatra, which is Tikshna, should be chosen. This is what Ishwari sir used to tell. And whenever you used to perform Vamana, especially in leprosy patients, he used to always perform Vamana in Jyeshtha Nakshatra. And if it is any diseases such as Avarna Pradhana Vikaras, Sangha Pradhana Vikaras, in all those, you should choose Chara Nakshatras. Chara Nakshatras, as I earlier said to you all, Swati and Soumya are said to be, Swati and Shravana are said to be Chara Nakshatras. So if you are going to perform Vamana in these Nakshatras, these Chara Nakshatras have the extra edge in giving you all a potency to treat such diseases where Avarna can be compacted, or maybe Sangha Pradhana Sampraptis may be compacted. And in all those diseases such as Rohini and Soumya here is Margashira. In these two nakshatras, you want to choose Vamana, you want to perform Vamanas in these two nakshatras, then probably if you are performing Vamana in a Madhatyaya patient, always there is a risk of esophageal variasis. There can be Ratta Chandrika Darshana or such weapons, or maybe erosive gastritis such as Amlapitta, etc. In all of these patients, if you want to conduct Vamana and if you want to have a special safety measure, then choose Rohini Nakshatra, then choose Soumya Nakshatra. In these nakshatras, if you conduct Vamana in a Madhatyaya, in a Amlapitta patient, in a gastritis patient, then the risk of having Ratchatandrika Darshana is far less. I have seen it. I am practicing it. In most of the patients, maybe I will try to adjust it according to these nakshatras. This is what Dr. Ishwari sir also used to do. And if it is Pushya Nakshatra, Hasta Nakshatra, Ashwini Nakshatra, it is Shipra or Lagu. Maybe if you want to give Rasayanas, if you want to generally give Vamanas, as in case of Vasantarutu, etc., these are the Nakshatra that was preferred. This is about Samanya, Ishta Nakshatra Samanya. But if it is Vishishta, then it should be as per Tala. There are 9. Among those 9, 4 are said to be good, and 4 are said to be bad, and 1 is said to be neutral. So probably you can look at that. If you are interested, you can just look at that. And in each of them, there will be 3, 27 minutes. In each of them, according to your Tula, it can be 3. So if it is Vishishta Nakshatras, you can just go, and if you are interested, you can just dig deeper into it and then go ahead. This is what is the missing link. You can definitely make use of this. Others, probably all of you are using, I feel. This is probably the missing link. So in these 3 missing links, that is, I said, Anupahata, Manasam, Abhisamiksha, you are supposed to first ascertain that the patient is not having Raga, Dvesha, Adis, etc. And at that particular time, when you are posting the patient for Vamana, Anupata Vastra Samvita, drape the patients with a continuous cloth, maybe something like a dhoti or something like a sari, etc. Ishta Nakshatras. Ishta Nakshatras are these 8 nakshatras. Among 27 nakshatras, these are the 8 nakshatras, and others are to be avoided. Others are to be avoided. Now, Vamana Karma in Vishishtavastas. It is Araharogi, Araharoga, and Araharoga. Say, for example, if it is Estula Madhme, Mamsala, Medura, Bhuri, Shleshma, Vishamagnescha, Snehachitaschaye, Snehastan, Puram Rukshit. In all those patients who are Mamsala, who are Medura, who are Bhuri, Shleshma, and having Vishamagnescha,
Recording in progress.
or any of this, or some of this. It can be Mamsala, it can be Medura, it can be Bhuri Shleshma, it can be Vishamagni. In all those patients, if you directly go ahead with Snehapana, after doing Pachana and Deepana, probably you are at the risk of developing Vyapats, that is Sneha Vyapats. And hence, you are supposed to do Rukshana. How can you do Rukshana? Rukshana can be done Abhyantara Rukshana or Bahya Rukshana. Bahya Rukshana is Udvartana. And when we do Udvartana, we have a special edge. Why? In Shushrata Samhita, Chikitsa Sthana, 24th chapter, somewhere in between 50, 51, 52, he explains about Udvartana's special impacts, wherein he says Siramukha Viviktatvam, Tvachasta Agnehe Tejanam. It imparts Siramukha Viviktatvam, Tvachasta Agnehe Tejanam, apart from Kaphameda Vilapanam, etc. So Siramukha Viviktatvam is very, very important for us, such that in all this Mamsala, Medura, Bhuri, Shleshma, etc., the Svedovaha Srotas is compromised. So Suramukha Viviktatvam, and especially in all these patients, if they are dyslipidemic, in all these patients, there is also atherosclerosis. So Siramukha Viviktatvam is very, very important. Mamsala, Medura, Bhuri, Shleshma. In these conditions, if we post the patients for Rukshana, we get special edge. Before posting the patient for Vamana or Snehapana, Mamsala, Medura, Udvartana or Rukshana in the form of Takrapana or any other Rukshanas, you all can choose. The next Arvarog is Sakshara Lavana Sneha. Mandagni Krura Koshta cha Sakshara Lavana. If there is Mandagni and Krura Koshta. So in that patient, it is Sakshara Lavana. You are supposed to choose. Maybe it is Yakshara Pachana Churna, anything like that through your Sneha. When you give this, you can see better results. Irsha Snigdha. Vishabhigata Pedakanam Kusta Shota Visarpinam Kamala Pandu Mehartim Na Ati Snigdhan Vishodo. When you look at these diseases, most of them are, some of them are Kleda Pradhana Vikaras, some of them are where Bala is less, some of them gives rise to different complications. So hence, if you go for Samyak Siddha Lakshanas, then there is definitely a risk of the patient developing complications. For example, if I take Meha, any patient who is having Meha for the past 5 years, 6 years, or 10 years, if the patient comes to you all and you think of posting the patient for Vamana, there, if you are posting the patient for Vamana, as explained in Shushruta, etc., where it says Tatraditavas, Nigdamanyatamena, Priyangvadadisiddena, Tailena, Vagrutena, Vamayat Pegadam. So if you just go ahead with that type of Snehapana, where you do either Arovana Sneha or any other Sneha till Samyak Nigdalakshanas, etc., then there is a thin line differentiating where it can definitely trigger nephropathy, it can definitely trigger some other complications, and hence in all such patients you will have to carefully choose, very, very carefully choose only Sadhyo Sneha, and probably you will have to repeat this Vamana Sarvinations. That is what is said in Kushta also. For example, if you look at Kushta, he says in Pakshat Vamanam or Masat Virachanam in case of Kushta, so you cannot just go ahead with others because it may give rise to complications. And when you look at this, he says in case of Kapha-pradhana doshas, it is Pakshat. And whenever it is Vishramakala in Vamana, 1 day Vishramakala, but in Virechana there is 3 days of Vishramakala, and Masat Virachanam and Pakshat Vamanam. When you look at this, in Kapha dosha, there is something called as Guru, Snigdha, etc. gunas. In Pitta dosha, Sasneham, Tikshnoshnam, Lagu Visram, Saram Dravam. And Snigdha and Sasneha. Sasneha is Irsat Sneha. And snigdha is yasya kledane shakti sa snigdha. So in kapha pradhana kushtas, accumulation of kleda is faster, and hence pakshat vamana, because it is guru snigdha. In pitta pradhana kushtas, isha snigdha. The accumulation of kleda is comparatively slow, and hence masat virechana. Same way in Vamana, 1 day Vishrama Kala for Vamana and 3 days Vishrama Kala for Virechana is accumulation of doshas is faster because as a kledane shakti sa snigdha, and kapha consists of snigdha guna, and this kledane shakti or mobilization of kleda pradhana doshas are faster, and hence only 1 day of Vamana Vishrama Kala is enough for Vamana, and 3 days of Vishrama Kala is required for Virechana, and 15 days of gap in between Vamanas and 1 month of gap in between Virechanas is required. And in diseases such as Pandu, you see, if you look at Kusta or Meha or Pandu, in all of these, there is Shitilata. When you look at Pandu Samprapti, it says Doshaha Pitta Pradhanasu, Yasyakti Dhatushu, Shaitilyam Tasya Dhatunam, Gauravam Chopajayate. There is Shitilata there. Whenever in cases of such patients, if you just go ahead with normal Snehapana, then there is Maya of Shvayatu or pedal edema, etc., developing as complication, and hence probably we are not supposed to go for that. Here, probably we should go for Isha Snigdha, and in those patients, after Isha Snigdha, maybe Vamana or Virechanas are to be repeated, looking at the bala of the patient. Now, Sadhyomana. The context of Sadhyomana, when you look at Charaka Chikitsasthana, 3rd chapter, he says, Kapha Pradhanat Utlishtam Doshanam Amashe Stitam Bhadda Dvarakaran Kale Vamyanam Vamanam. When you look at this, he says, the condition is Kapha Pradhana Dosha, Utlishta Dosha, Amashe Stita Dosha, and Dvarakara Doshas. When all of that is there, why do you want to go for Purva Karma, such as Dipana Pachana, such as Nehapana, such as Sveda, etc.? When you look at this, it is not required. That's what Chakrapani says. Dosha Utklesha Prayajanakau, Sneha Svedau, Na Kriyate, Alpau Va Kriyate. Either looking at the condition, you can either skip Sneha Svedas, which are useful for Utkleshana of the doshas, or you can perform it in a meager way or a small. Dosha Utklesha Prayojanakau, Sneha Svedau, Na Kriyate, Alpau Va Kriyate. There are 2 different conditions, he says. Whenever the doshas are Kapha Pradhana doshas, they are an Utlishta Avastas, they are already Stita in Amashaya, then why do you want to go for Sneha Svedas? This is a condition which is definitely fit for Satya. And how do you understand Utlishta doshas? Shushruta and Sharirasthana 4th chapter has given you very clear guidelines as to how you are supposed to understand Utlishta doshas, such as Utlishyanam na nirgachet, Preseka Stevene Ritam, Hrudyanam Pidate Chasitam Utleshanam Vinirtashit. So when you look at this, you understand that there are Utlishta Avastas. These are already Utlishta Avastas. So there is no need for going ahead with Sneha or Sveda. Now, this is what I was talking to you all about. Dosha Utlesha Prayajanako Sneha Sveda Na Kriyate Alpava. Now, this was about some of the Vishishta Purva Karmas. And now in case of Vishishta Pradhana Karmas, if Samyak Nigdhata is there, Samyak Nigdham Chet Nirannam. In Pradhana Karma, you are supposed to give Aushadhi in Niranna Avastha. Don't go for Akantapaya, Vamana, Akantapaya, etc. Here, the guidelines in our text are, if Samyak Nigdha Lakshanas were achieved in the patient, then Samyak Nigdham Chet Nirannam. In Niranna Avastha, you are supposed to give Vamana Aushadhi and conduct Vamana. This is what probably Dr. Shreyas in our institution, who is an assistant professor working in Department of Panchakarma. His PhD topic is about this. He has taken 3 different groups. Samyak Nigdam Chet Nirannam, Irshas Nigdam Chet, Peya Pita Sarpisham. If there is, as I said to you all, if you have performed Irshas Nigdaha, only 1 day Snehapana or 2 days Snehapana, you have added Lavana, etc. Maybe something like wherever any patient cannot follow the rules and regulations of Snehapana, such as Bala, Sri, Vruddha, Sneha Parihara, Asaishnushu. In all these cases, you go ahead with Irshasnigdha. In these Irshasnigdha patients, Peya Pita Sarpisham. After you have given Peya with Sarpi, you can give Vamana Aushadhi. This is the Vishishta Pradhana Karma Avastha. Yes. Now, there is something called as Anarha. Which is the Anarha Rogi? Maybe Bala. These days, probably Balas, we seldom see or perform Vamanas in Bala, but those days, probably just because nebulization, etc., was not there, in severe bronchospasms, wherever there was difficulty in breathing, maybe Vamanas were performed. And there, in Charaka Chikisasana, 30th chapter, 283 shloka, he says, Nivrittir Vamanadinam Mrudutvam Paratantranam Vak Chestayor Samartyam Vikshaha Baleshu Shastravit. You are supposed to see whether the child is able to express any difficulty that is happening, whether his tummy is full, is having pain in the stomach, etc. Vak Chestayor Samartyam Vikshaha is able to at least show you through gesture that there is some discomfort. Just Vak Chestayor Samartyam Vikshaha, then you can definitely perform Vamana in those patients if you feel that it is to be performed. Or this is the only procedure which can give relief to the patient. In such cases, definitely in Balas, you can definitely perform it. Chakrapani says, Kartavaha Vak Chestayor Balasya Samartyam Vikshaha Swatantratam Jatam. Whether he is Swatantra or Paratantra, he is able to express by himself or he relies to communicate to you through his mother, Paratantratam. If he is relying on his mother to communicate to you, then he is not fit for Vamana. If he is able to express to you, then he is fit for Vamana. And we get a cross reference in Charaka Kalpasthana 8th chapter, wherein he says, Draksharasa Yuktam Dadyata Daha Udavarta Pedikam Chaturvarsha Mukhe Bale Yavad Dvadasha Varshike. If he is telling that Virechana can be given for a Chaturvarsha Mukhe Bale, probably he is giving us a hint that maybe at 4 years, the child will be Swatantra, not Paratantra. Right? This is one cross reference where we get that in children, maybe in 12 and 4 years, we can perform in case it is absolute requirement. Vamana in Anarha Roga, Chardi, Rudroga, Gulma, etc. In these patients, maybe Vamana is contraindicated, such as Aruchi, etc. Whenever it is Aruchi, etc., especially in Vata Gulma, we see in Shushruta Samhita, he has given us particular Vamana Upagadravya, such as Vachambu in case of Vataja, Gudambu in case of Pitta, Nimbambu in case of Kapha. If you all want to go through, then you can definitely look at Shushruta Samhita, Uttara Tantra 57 chapter 6, 7 and 8 shlokas, where he is very particular about in cases wherever there is Vata Gulma. Vata Gulma is where in Charaka Samhita Sutrasthana 18th chapter he says Shula Shotadi. Shula Shotadi is whenever there is infections in the GIT. In Mahasrotas, whenever there is GIT, there is infections, something like pancreatitis or something like any of these ITs that are there in the GIT Mahasrotas, in all of such, we can consider that as Gulma as per Charaka's version in Charaka Sutrasthana 18th chapter, wherein he says Gulma is Shota and Shula in Mahasrotas. If that is there, if you want to consider this, then probably in such conditions, if it is Vata Pradhana, then it must be Vachambu. In Pitta Pradhana, it must be Kudambu. And in Kapha Pradhana, it can be Nimbam. You are supposed to conduct Vamana with this. So particularly, there are some specific conditions where you all can definitely make certain specific choices and then conduct Vamana. Yes, I was talking to you all about Ajirna and Visha, the same as Eshti Madhukashaya in case of Ajirna. One more such specific condition. Now, Vishishta Paschat Karmas. Now, after Vishishta Purva Karmas, there were Vishishta Pradhana Karmas. Now, Vishishta Paschat Karma. In Vishishta Paschat Karma, you must have seen in Paschat Karma, Samanya Paschat Karma, Peyadi Samsarjana. That is one Annakala in case of Avara Shuddhi, two Annakalas in case of Madhyama Shuddhi, three Annakalas in case of Pravara Shuddhi. It is something similar to if you go to a allopathy doctor saying that you are having loose motions for 5 to 8 times, he will ask you to take 1 pint of fluids, or if it is more than that, 2 pints, and then something more than that, 3 pints. Yes, maybe pay the 1 Annakala, 2 Annakala, 3 Annakala, depending upon that. Yes, that was what is explained, not only for that purpose, even for Agni and etc. Peyadi Samsarja Krama. Then he says, Srutalpa Pitta Shleshmanam, Madhyapam, Vatapetikam, Peyam Napayet, Tesham Tarpanadikrama. Whenever there is Hina Shuddhi, Sruta Alpa Pitta Shleshmana, Hina Shuddhi, then Peyadi cannot be given, Tarpanadi should be given. And in other specific conditions such as Meha, in Meha, Santarpana to be taken, you cannot just go ahead with Peyadi, or else you definitely will come across certain complications that are explained. Srutalpa Pitta Shleshmanam, Madhyapa, if he is a Madatyaya patient, never go ahead with Peyadi Samsarjana, definitely choose only Tarpana. If he is a patient of Vata Pittaja Prakruti or Vata Pittaja disease, then also Tarpanadikrama is to be chosen. Why? Because those are the ones which do not have the ability to there. In such conditions, you are supposed to choose Tarpanadikrama. And then there is one more Vishishta Paschat Karma that Shishtuta in Chikitsasthana, 33rd chapter, 11th sloka has said, Tato apare, Suchi Shuddho Dehe Ushnam Abhisarat. Kulatta or Mudga or Adaki Jangalanam Yushai. Immediately you can go ahead with Kulatta Yusha. There was one thesis performed in our institution last year. Dr. Bharadwaj had performed this. We have observed very good results. Kulatta Yusha was given immediately for the very first Annakala to all those patients. You can just go through the Tika of this, wherein he says whenever there is no Shesha Dosha, then there is no, or Agni is not compromised, then there is no need of Peyadikrama, then you can definitely go for Kulatta or Mudga or Jangala Mamsarasas, etc. And whenever you have repeated Vamanas or Virechanas, maybe in cases of avascular necrosis, where you it's an Asti Pradosha Vikara, and where you go ahead with the choice is Panchakarma Beshaji, that is Vamana followed by Virechana, then you go ahead with Bastis, etc. Or maybe in Kushtas, where you repeat Vamanas or you repeat Virechanas or so on and so forth. In such conditions, then you are supposed to go ahead with Vamanadinam Karmanam Punarapi Antare Antare Sneha Sweda Pranjata Snehamante Balayacha. You are supposed to go ahead with Brahmana Sneha in case you are going ahead with repeated Vamanas and Virechanas. And whenever you are going to go ahead for repeated Vamanas and Virechanas, ensure that it must be a case like Pandu or Kusta. In such cases, you are supposed to remove Alpalpa doshas. In Alpalpa doshas, when you remove that, you will not be having Bhaya of Swayatu. Yes, this is what I was talking to you all about. Vamanadinam Karmanam Punarapi Antare Antare Sneha Sveda Prajutaha Snehamante Balayacha. That is, you are supposed to end it with. That is, after you give Vamana for first dose, first course, then maybe gap of 15 days, then Vamana. Maybe after third Vamana, you are supposed to go ahead with Brahmana Sneha. And if you are going ahead with Virechana, Masat Virechana, if you want to stop, then once again go ahead with Brahmana Sneha. Or Vamana followed by Virechana, then once again you are supposed to go ahead with Brahmana Sneha. So in all of this, remember Brahmana Sneha is to be given. For example, if you are thinking about giving Brahmana Sneha, how are you supposed to give Brahmana Sneha? Maybe Brahmana Sneha Addehi. Shamana Sneha Kshudito Ananno Madhyama Matra Shashashate. The patient should be Kshudita, Ananna Avastha, Madhyama Matra. And if it is Snehapana, then it is Testane Jirnevan, Snehachashte. So these were some of the Vishishta conditions that I wanted to bring to your notice. Now, what is the use of these Shodhanas? He says, Malapaham, Rogaharam, Balaprasadanam, Varnaprasadanam, Pitva, Samshodhana, Samyak Ayushaha Yujjate Chira. One intention is Malapaha. Second intention is Rogahara. Third intention is Balaprasadana. Then Varnaprasadana. Pitva, Samshodhanam, Samyak Ayushaha Yujjate Chiram. Samyak Ayushaha Yujjate Chiram is very, very important. That is, you will not be having complications, or maybe if I am to put it in other words, increasing the shelf life. That is, if I give you all something like 4 different types of tomatoes, one tomatoes selected, cleaned, etc., very good tomatoes, and the other tomatoes, they are not selected, they are just randomly picked. The other tomatoes which were not segregated at all, then when I ask you all to preserve this, then if some of you all try to preserve this in a refrigerator, maybe it is something called as a kuti praveshika rasayana, or somebody wraps it in a wet cloth, it is something called as atatapika rasayana, vatatapika rasayana, and somebody does not follow anything, then you can see the shelf life get increased only for the tomatoes, those which were segregated, cleaned, etc., chosen, picked, and then they were kept in a fridge. The shelf life increases. So one who performs samshodhana regularly, one who takes rasayanas, performs dinacharya, ruticharya, etc., maybe samyak ayushaha yujjate chira. So for them, the ayush will be for chira without any deformities. Yes, now in Shushruta Chikitsasthana 33rd chapter, he says, what are the benefits of this Vamana? Kasa, Upalepa, it is good for Kasa. Upalepa is many of these Upalepa diseases such as atherosclerosis in different areas. Swarabheda, Nidra, Tandra, Daurgandhya, Andhya, Visha, Upasarga. When you look at Upasarga, Dalana says Shitalika Adayaha. Shitalika Adayaha has this viral infections or any other infections. So if you regularly perform Vamana, he says Nasantihi. You are not going to come across these diseases such as Kasa, such as Upalepa, such as Swarabheda, Nidra, Tandra, or Upasargana, etc. And hence, maybe if we are very careful in choosing, performing Vamana, maybe risks are very, very less. And these days, I have observed many of the private Panchakarma centers, number of Vamanas that are done are very, very, very less. In colleges or institutions, also they are coming down because of various reasons that I have quoted to you earlier. Though there is therapeutic potential, Vamana is definitely useful. If we all want to really know or perform or give evidence, then probably we will have to think about conducting network pharmacology or maybe molecular docking studies, in silico studies. Usually what happens is the modern doctors, they usually first choose in silico studies. And in the in silico studies, if they come across any molecule which can bind to any targets, such as the protein target, the receptor target, or the gene, etc., which is misbehaving, if this molecule can target and stop the disease, then they say it exhibits high potential. But here we are with a situation where Vamana is practiced for quite a few years, few decades, or I should say, from the time of Charaka is documented. As I said to you all, you all can imagine when we were performing Vamana. I said to you all earlier, we did not have a lab there, but still, Ishwar sir used to rely on clinical assessment and then perform Vamana. If we had to shift the patient, then the nearest other hospital was Ghosh Hospital, which is around 1.5 kilometers from our hospital, and the mode of transport then were very less. There were no autos, nothing like that. We had to take them either in our cycles or maybe one or two two-wheelers, that mobile mopeds that were there. So just because sir was so confident in treating the patients, we did not come across any such complications. There was no need for us which arose for shifting the patient to a nearby hospital. Or maybe we did not even see even one case also which required IV fluid or something like that. So, Vamana, if you want to give evidence, probably in silico studies, molecular dockings, or maybe you'll have to think about conducting network pharmacology. For Vamana, maybe institutions like Tarnath Government Ayurveda College can have easy accessibility for funds, etc. I request Dr. Santosh or maybe Janaki Madam, and especially Dr. Rajshekar Ganigeri, who can definitely mobilize such funds to give evidence-based research as possible. Yeah, with this little talk, maybe I will conclude, and I take this opportunity to thank the organizers, especially Janaki Madam, Rajshekar Ganigeri, Santosh Edahalli, Hugar, and Shilpa. Thank you one and all for a patient hearing.
Thank you very much, sir. On behalf of everyone present here, I express our sincere gratitude for highly informative and intellectually stimulating lecture. Your comprehensive presentation on the practical clinical insights and your vast experience has significantly enhanced our understanding of the important Panchakarma procedure, therapeutic potentials of Vamana, enriched with classical concepts. We shall now proceed to the interactive question and answer session, sir. We have collected the questions from the participants and PPT is made. We'll share the PPT, sir. We shall take up the questions one by one. Sir, our first question is, as Greha Vamana Yoga is indicated in Sukumara persons, how to assess Sukumarata?
Yeah. In Charaka Sutra Sthana, when you look at assessment criteria, and in Shushruta Sutra Sthana 35th chapter, Atharopakramaniya Madhyayam, he has given you various parameters to assess Sukumarata. And in Sukumara, maybe there are conditions such as women or Bala or Buddha and other such conditions, and maybe conditions such as Meha, etc., fall under Sukumara because they are Shitilata, Shitila Mamsa is there, and you get lots of other references for Sukumarata. You please look into Shushruta Sutrasthana 35th chapter, Atharopakramaniyam Adhyayam, and you'll get an answer.
Okay, thank you, sir. Our next question. Why have the Acharyas described disease-specific Vamana Yoga despite the understanding that Vamana drug action without undergoing digestion?
See, I said Vamana, it acts something like a massive reset switch. It is something like, for example, if you see in Vamana Dravya and Virechana Dravya, the only difference is Urdho Bhagahara and Adho Bhagahara. If you see Sukshma, Vikasi, Ushna, Tikshna, etc. gunas and Urdho Bhagahara and Adho Dosha Bhagahara. And when you look at Vamana, the phytochemicals that are present in a Vamana Dravya, and in these phytochemicals, most of them are lipophilic. And in Virechana Dravyas, most of them are hydrophilic. And these lipophilic phytochemicals are having the ability to do transcellular. They can have transcellular penetration. Whereas paracellular penetrations is hydrophilic. So those which are transcellular and lipophilic, they have the ability to cross the blood-brain barrier and hence give rise to Vamana. And all those which are hydrophilic, they are paracellular and they act in a different way. So each of these Vamana Dravyas that are specified in Kalpasthanas, they have a special ability to enter into the cell, that is transcellular. So when this is happening, they can trigger the centers that you are talking about and you are all familiar with in a different aspects. And this is called as hormesis effect. If you can just go through and understand what is this hormesis effect, what is this massive reset switch that I am talking about. You all have this AIs these days. You all can just try to understand. It's very easy for you all to understand why Charaka has given you so many yogas.
Thank you, sir. Our next question. So, what is the role of maintaining different Akantapana beyond Satmyata, that is palatability? Is there any clinical utility?
Yeah, as I said to you all, now see, clinical utility, as I said to you all, Dr. Shreyas is performing Vamana in 3 different groups. Samyak Digdam Chet Nirannam, then in Biru, Bala, Sukumara, in all these conditions is where Akantapaya Vamana is said. But these days we are trying to give Vamana in all patients with Akantapana. That is not the condition that we are supposed to give Vamana. Vamana only in Biru, Bala, etc. In these conditions only we are supposed to give Akantapana. And in Akantapana, if you are asking me about different liquid medias, probably these liquid medias are for different prakrutis or different clinical conditions. Maybe some of the clinical conditions which are Pitta Pradhana, or some of the clinical conditions which is Vatanubandhata, which is Kafanubandhata, etc. So those are the medias which help protect the mucosa, gastric mucosa. So in those clinical conditions, maybe we are supposed to choose Akantapana.
Okay, thank you, sir. Next question. Madhu Madhuka Saindava Fanitopahitam Madanafala Kashaya Matram Payet. What is the role of Fanita here?
Helps penetration of the phytochemicals. It helps penetration of the phytochemicals in a better way.
Thank you, sir. Next question. What is the clinical significance of using specific Vamana Yoga for particular indications such as Madanafala Kshira Yoga in Adhoga Rakta Pitta? If you have used this formulation in your practice, could you please share your experience and the rationale behind this selection?
If you are asking me if I have used, no, I have not used. I have not used this particular things in Adhoga Rakta Pitta at all. Because for Adho Rakta Pitta, we do have many other less invasive procedures.
Thank you, sir. Next question. Difference between Avrita Vata and Gata Vata. Clinically, sir.
Avrita Vata and Gata Vata. See, if you are asking me this question, if you all look at Charaka Sutra Sthana 17th chapter, Kiyanta Shirshiyam Adhyayam, there Charaka talks about a Madhumeha type, and in this Madhumeha type, he talks about there is Avarana. Whenever he is talking about Avarata, Avrata Gatir Vayu, Oja Adaya Gachate. So, pardon, sir?
Participants, please mute you.
Yeah, Charaka Sutra Sthana 17th chapter. I was talking to you all about when he is explaining about Madhumeha and its Samprapti. He says, Shleshvam cha pittam cha medam cha mamsam cha ati pravartate tair avrutah gatir vata. That is, there is avarna to the gati of vata by shleshma, by pitta, by medas, by mamsa, etc. That is, he is talking about resistance to insulin, insulin resistance. Gati of vata avarna. He is talking about resistance to insulin. Whenever there is resistance to insulin, then probably we are supposed to think about or go ahead with this. So probably if you are talking about Avarnavata, maybe it will become easier for you all to understand in the lines of endocrinology, wherever there is Avarna or resistance to the action of any hormones. Right? Maybe it will help you all understand in a better way. Right? Gatavata, inflammation, itis in those reasons. Maybe it is something like osteoarthritis or cervical spondylitis or any particular reasons there is inflammation, and these inflammations are understood as Gatavatas.
Okay, thank you, sir. Next question. How do you assess the Samyak Yoga Lakshana of Sadhya Vamana in acute or emergency clinical condition, and what parameter do you consider essential for evaluating its adequacy?
See, as I said to you all, earlier, maybe 30 years back, when there were no nebulizers, etc., there were emergency clinical conditions where we used to perform Vamanas. But these days, in such clinical conditions, we do not or we seldom perform Vamanas. Vamana Karma is now usually performed only and only in such conditions, maybe in Ajirna conditions, whenever a patient comes to us and is having severe pain, it is only Ajirna, or only in such conditions, maybe. Or else, probably in emergency conditions, Vamana is these days not performed in emergency conditions. It is always a selective procedure where we select based on certain conditions such as psoriasis, or maybe PCOS, or maybe MEHA, or such clinical conditions. And seldom we perform Vamana in emergency conditions these days.
Thank you, sir. Next question. According to a clinical experience, what is the effect of Vamana on the hormonal profile of PCOS patients? Does it improve ovulation only through correction of dosha imbalance?
See, if you're asking me my clinical experience, because all through my career, I have been practicing in institutions. So in these institutions, there is a Prasuti Striroga department. So I do not get an opportunity to treat patients with PCOS at all. But still, just because I get lots of patients with PCOS, I, along with the teachers from Prasuti Striroga, we do treat patients of PCOS with Vamana, and Vamana has very good results. It definitely improves ovulation. I should say 80% cases I have seen, it is definitely useful. And my colleagues and me, first choice in PCOS is Vamana. First choice is not Virechana, it is Vamana. Udvartana and Vamana is the first choice in PCOS.
Okay, sir, thank you. Next question. What clinical sign make you postpone Vamana despite completing Purvakarma?
Major thing is menses, especially in female patients. What happens is, though we have ensured or taken the history about their cycle, but still, in some patients, after Snehapana, there will be preponement of menses 15 to 20 days also in some patients. In some patients, 10 days, and most of the patients, at least 7 days preponement will definitely happen. This is one clinical this thing where we are forced to postpone Vamana. One. Second thing is, in some patients, we do come across patients having infections such as common cold, fever, etc. In those patients, yes, we were forced to postpone Vamana. These were the reasons that I have seen in my clinical practice.
Okay, thank you, sir. Next slide. Can you share your clinical experience over Ayoga and Atiyoga Lakshanas of Shodhana and the Chikitsa?
Atiyoga Lakshanas, initially, maybe starting of my career, 4 or 5 patients we had come across Atiyoga Lakshanas. These days, we do not come across Atiyoga Lakshanas. We don't take chances. We assess properly. We are very careful in choosing the dose, and we are also careful in choosing the medicines. Even if it is other medicines, we ensure with very small doses first. We see it is better. Ayoga is, hence we do not come across Atiyogas these days. Vapats, if you're asking me, sometimes when Vamana Dravya is given, maybe 4 or 5 Vamana Vegas. Later, when the patient goes back to the ward, there are lots of Virechana Vegas that happen. This is probably one common Vapat that we come across in patients who are given Vamana Dravya. Ayoga, very rarely do we come across Ayoga, only in those patients where the patient is reluctant or does not cooperate in taking Vamanopaka Dravya such as Madhyastifat or Lavana Jala properly. Only in those cases we have come across Ayogas. Maybe in those, we usually go ahead with the guidelines that are given in the text, such as where we go for Shita Jala Parisheka for Urdhva and Ushta Jala Parisheka for Adakaya, and then we try to induce Virechana Vegas.
Thank you, sir. Next question, sir. What are the parameters to decide Mrudu and Tikshna Vamana?
Parameters to decide medicines, or it is after conducting Vamana? There's no clarity in this question. Maybe if you are talking to me about Avara, Madhyama and Pravara Vegas, or I don't know whether it is Mrudu Vamana Dravya, Madhyama Vamana Dravya, or Tikshna Vamana Dravya.
Sir, with respect to medicine, sir.
Medicines, probably Vimanasthana, we have very clear instructions and this thing that how are we supposed to make a Vamana Dravya Mrudu and how are we supposed to make a Vamana Dravya Tikshna, depending upon whether it is Shita Pradhana Rutu or so on and so forth. See, some of my students who are practicing in Jammu and Kashmir or Punjab, etc., they always say that, sir, yahan bahut thanda hota hai, and Vamana is usually very, very difficult. Then that's what I say. You'll have to make the Vamana Dravya Tikshna and then perform Vamana. And in Mrudu, maybe if you just go to Mangalore, etc., during summers, it is very difficult for you to give a Madhyama Virya, Vamana Dravya to a patient for Vamana in Mangalore. I was there for a short period in Mangalore, and I have noticed that it is very difficult for you to give a Madhyama Virya Vamana Dravya for Vamana in summer seasons. So, Mrudu, it should be definitely we are supposed to look at the guidelines that are explained in Charaka Vimanasthana, make the Aushadhi Mrudu and that.
Yes, sir. Thank you, sir. Next question. What are the earliest signs that indicate Atiyoga is likely to occur?
As I said to you, Madatyai or maybe Amlapitta patient where there is erosive gastritis or Kosta, it's Mrudu Kosta, or Pitta Pradhana or Vata Pitta Pradhana. These are the ones which are very dangerous. These are the ones which are very, very dangerous. These are the ones where we usually come across Atyogas. See, if you see Yogavahi Paramvayu Sanyogat Ubayartha Krutaha, and if it joins with Pitta, it is going to give rise to Ushna, and with Kapha, it is going to give rise to Shita. In Pitta Prakriti persons, especially if you are going to give rise to Vamana and gastritis patients, you are supposed to definitely think about Atyogas. Atyogas, very, very, very dangerous in those patients. Vata Pitta Pradhana patients, Vata Pitta Pradhana Prakritis, and Amla Pitta conditions. Vata Pitta Pradhana patients, Madatyayi Amla Pitta conditions, very dangerous. Very dangerous. Be very careful, and you will have to definitely think about Mrudu Vamana Dravyas or only Vamanopaka Dravyas in such patients. That is why probably when you look at Shushruta, he talks about Gudambu. He talks about very clearly in Pitta, in all such conditions, it must be Gudambu. So maybe we get clues everywhere in the text, that we are supposed to take these clues and then go ahead with the conduction of these treatments.
Okay, thank you, sir. Next question. If a patient does not develop adequate Vegas after administering Greya Vamana Yoga, what should be the next step? Is repeat oral administration of Vamana medicine is recommended?
We have not. We have not done. So I do not have experience. Whatever is I am supposed to tell, I should be telling only based on the reference or textual knowledge. Maybe it should be repeated. I do not have experience of conducting Greva Mukha Yogas.
Thank you, sir. Next question. Sir, please explain Doshotkleshakara Ahara prior to Vamana. Dallana has commented Sambhojana or Samashana. What we can consider here?
See, Utkleshakara Ahara is all of that. See, Charaka is very clear, and some of the other authors are very clear in talking about you are supposed to give Dadi, etc., etc. So, Utkleshakara Ahara, once again, as I said to you all, any snehas can definitely give rise to Utkleshas, or Dadi, etc. They can give rise to Utkleshas. Maybe Sambhojana, you are supposed to look at the quantity, see that there is no ajirna for the next meal, and you are supposed to choose such of the ahara dravyas which can definitely not interfere with the conduction of Vamana. Maybe Sambhojana or Samashana is with that.
Thank you, sir. Next question. Few practitioners advise fried food like vada, jalebi prior to Vamana. Can we give this food articles also?
Yes, yes. In my practice, I have been advising that, and I get good results. When I don't do that, I do not get desired results.
Okay, sir. So next
They are Abhishanakaras. They are Utkleshakaras. Yes, probably yes. See, we had conducted one study, one thesis. Dr. Sitaram. Dr. Sitaram's thesis was in psoriasis, we had given Snehapana, Kshirotta and Dadyotta. See, Sneha, when we prepare a Sneha, Kshirotta is good for Shamana, Dadyotta is good for or any foodstuffs or dravya that we use during Purva Karmas should aid Vamana. Dadyotta Sneha that we had conducted, the Gruta, Dadyotta Gruta that was prepared was so good in performing Vamanas. We have seen that. Kshirotta Grutas that is available in the market, probably when we compare it with Dadyotta Gruta, then we can see the difference. The Utklesha effect we can see there.
Thank you, sir. Our next question, sir. In Charaka Siddhisthana, Acharya Charaka explains the mode of action of Vamana and Virechana through various properties, including Vivai and Vikasi gunas. However, these gunas are not described for most Shodhana Dravyas in the classics. Then is it appropriate to explain this action through Prabhava, or should these gunas be understood as functional property manifested during Shodhana rather than guna of Dravya?
No, they are definitely gunas of the dravyas, and they can also be manifested during shodhanas. But it is not necessary that all of them should have all of them. Some of them will be pradhana with this type of gunas. Maybe in some the Vyakta guna is more, Prabhava may be more, in some Ushna may be more, in some Tishna may be more, and so on and so on. But Urdhva Doshara Prabhava should be there for Vamana. Adho Dosha Prabhava should be there for Virechana. As I said to you all, whenever it is Urdhva Doshara Prabhava, if you all can see most of this Urdhva Doshara Prabhava, those dravyas, when you look at Urdhva Doshara Prabhava, I mean to say the phytochemicals are lipophilic. Whenever these are lipophilic, they are transcellular. And whenever I say it is Adho Doshahara, it is hydrophilic. They are paracellular. So those which are transcellular have the ability to cross the blood-brain barrier. Those which are paracellular, they can have the ability to cross the GI. The effect is very clear in seen. So maybe we are supposed to dig in. We are supposed to probe to understand the effects of all other gunas.
Thank you, sir. Our next question, sir. Since manual blowing produces variable pressure, what innovative instrumentation can be developed to deliver fixed and reproducible pressure during Pradhamananasya?
You are all youngsters. You are exposed to so many things now, unlike us, where we did not have the exposure. You are the better persons to explore such innovative instrumentations. Maybe you should think about some chips, etc. You all can definitely come out when you have that question. If you go behind it, you can definitely get an answer.
Okay, sir. Thank you, sir. Sir, for Shodhananga Snehapana, the classics recommends Acha Sneha. In clinical practice, do you prefer Kevala Sneha or Samskrita Sneha, and what is the rationale for your choice?
See, Acha Sneha, a commentator is very clearly said, Vaidya Samskarita Siddha Sneha is called as Acha Sneha. So, Vaidya Samskarita Siddha Sneha. Whenever he says Acha Sneha, it is Kevala Sneha. Kevala Sneha is not Vicharana Sneha. That's it. So, Vaidya footsteps is said to be Vicharana Sneha. So, Acha Sneha, Hestane Jirnayavanne Sneho Achaha Shute Bahu is Vaidya Samskarita Siddha Sneha.
Thank you, sir. So, next question. As it is mentioned that Nati Snigdha Yavagu Grutavantam Pitavantam, is it is for Akantapana, or is there any dose specification for Yavagu?
Akantapana is for Biru, Ashtanga Hrudaya, and see in that particular context, I said to you all, Dr. Shreyas is working on this aspect in our college in PhD. He has taken this topic, and his topic is having 3 groups. In those 3 groups, in one group, he is giving Nirannavastha Vamana. Nirannavastha Vamana is whenever there is Samyak Snigdham Chet Nirannam. So in those conditions, he will definitely give Nirannavastha. The other conditions, Akantapayita is Bala, Biru, Vruddha, etc. In these conditions, he is trying to give Akantapayita Kshira. And Peyapita Sarpisha is Isasnigdha. Whenever there is Isasnigdha, maybe any patient who is having a history of Madhumeha for the past maybe 5 years or 6 years. These are the patients who are susceptible for certain of the complications such as neuropathy, nephropathy, retinopathy, etc. So those patients who are having chronic Madhumeha are at the risk of developing complications. In these patients, if you go ahead with normal Snehapana, then there is a risk of you pushing the patient towards complications. So in such patients, Natisnigdha Vishodayat is to be given. In such Natisnigdha Vishodayat, then Payapita Sarpisha Vamana is to be given. If Payapita Sarpisha Vamana is not given in those patients and we go for Niranna Vamana, then there definitely will be damage to the mucous membrane, and hence we do not take that risk. So Payapita Sarpisha is in those conditions. It is not for the conditions where Samyaksnigdha is achieved. Samyaksnigdha, definitely we do not choose Akantapaya.
Thank you, sir. Sir, our next question. Can Pravicharana Snehapana produce the same degree of Doshotklesha as Acha Snehapana, or is its effect limited to Shamana alone?
No, it cannot provide, because if you look at Ashtanga Hridaya Nasyadhikara, he is very clear in telling to you all about the difference between Pravicharana Sneha and Acha Sneha. They are very clearly differentiated, such as Marshanasya and Pratimarshanasya, or Kuti Praveshaka Rasayana and Vatatapika Rasayana. They are very clear in telling that they do not have the same effect. Pravicharana Sneha is always Adama. It cannot be compared with Acha Snehapana. Acha Snehapana is definitely best. You are trying to tell me, or you are trying to arrange a fight between a 7-year-old and a 24-year-old boy. Definitely it is the 24-year boy who will definitely win in any type of activities. A 7-year-old cannot win over a 24-year-old. So Pravicharana Sneha, if you are considering it as a 7-year-old, and Acha Snehapana as a 24-year-old, Acha Snehapana is the best. Look at Ashtanga Hridaya Sutrasthana Nasyadhikara. He has given you all differentiation between Pravicharana Sneha and Acha Sneha, and Marshanasya, Pratimarshanasya, Kuti Praveshika, and this thing, wherein he says the effects will definitely be lesser.
Okay, thank you, sir. Sir, our next question. If the duration and onset of nakshatra differ each day, on what basis should the timing of Vamana be fixed according to the nakshatra? Is the
Vamana Kala only. You are supposed to choose Vamana Kala based on this. You are supposed to choose Vamana Kala. First is, we are supposed to go for Vamana Kala, that is Kapha Kala, early in the morning. And that time, if you are having these nakshatras, any of these 8 nakshatras, and as I said to you all, if you are very particular, Madatyaya patient, then it should be Saumya nakshatras. If it is something like Avarana disease, then Chara nakshatras. If it is a deep-rooted disease, then it should be Jeshta nakshatra. You are supposed to look at the calendar, understand. If you want that extra effect, then you will have to. You will have to look at that, and it should be in Kapha Kala only. You cannot compromise with Kapha Kala.
ITCT, PTINR in all cases, irrespective of health and disease, as it like as threatening like understanding minor surgeries. Sir, which are the important investigations which we have to undergo before Vamana?
Not in all patients. Only when you have a history, positive history, if the patient is little overweight or something like that, aging 40 or more than 40, then maybe go ahead with screening for cardiac strains such as ECGs, etc., etc. If not, if it's a 20, 24 years child with Mukhadushika, etc., why do you want to go ahead with all of that? It is only waste of money, waste of resources. There is no need for you all to go for that, until and unless you are doing any researches, particular researches, and you are bound with some research protocols. Or else, I don't think in every case you are supposed to go ahead with certain things. No, absolutely no. If you are confident, Only in such cases where you sense that there is some risk, to rule out that risk, to choose the little milder forms, maybe you are supposed to go ahead with certain of those.
Namaste, sir.
Namaskara, madam. Ballari, madam.
Sir, thank you, sir. Thank you for this session. Now, question and answer session completed, sir. And fortunately, we have Dr. Anjaney Murthy, sir, with us. Now, sir will share his thoughts, sir.
Sir, namaste, sir.
ನಮಸ್ತೆ ಪಾ ನಮಸ್ತೆ ನಮಸ್ತೆ ನಮಗೆ ಕಿರಣ್ ಗೌಡ್ ಅವ್ರ ಮಾತು
I would like to share few words on Dr. Anjaney Murthy, sir, in case the organizers allow me.
Yes, sir.
Yes, sir, please, sir.
Yes, sir. Sir, Dr. Anjaney Murthy, sir, is my guide. When I was doing my post-graduation in Mysore, 1996, I will just tell you how passionate he is about. When I went to him and I asked him that I wanted to work on Meha, he said, I will give your choice only when you please me. If you don't please me, then you will have to stick on to my choice. I said yes. Then he asked me to go and collect information from 17 different PHCs in and around Mysore. He just called his friends. I went there to each and every PHC to understand what is the incidence of Meha in different PHCs, in rural areas and in urban areas in Chelvamba Hospital. That is one. Second thing is, he asked me to go and collect the remaining urine from different laboratories in Kannan pathology, etc., etc. There were some pathologies. There he asked me to collect this urine, and in the area where there is open to space area in Mysore, there we poured some sand and then we went on pouring this urine. So 5% urine sugar, 1% urine sugar that I collected from various labs. Only for 2% urine sugar, after 12 hours, there was Pipilika Darshana. For 1.5, 1%, we could not appreciate Pipilika Darshana. And then he asked me to collect some samples from pharmacy college, JSS Pharmacy College. That is how he pushes the students to understand different aspects of Ayurveda. So with this light introduction, I seek blessings with Dr. Anjaney Murthy, sir. Thank you, sir. Thank you so much.
I am fortunate to hear Dr. Kiran Gowda's lecture. I am proud to tell that Kiran Gowda is my student. Over the span of last 50 years, as this college is celebrating 50 years, we have seen small seed becoming a big kalparuksha. So Kiran Gowda entered this Taranatha college as Bija, and now he has become a big kalparuksha. What is this? Why I am giving this example? So many students of Taranatha are there here who are hearing this lecture in online and offline method. They should have one role model. What is the role model? Who should have expertise like Dr. Kiran Gowda, sir? Who should have theoretical mastery like Kiran Gowda, sir? And who should have clinical mastery like Kiran Gowda, sir? You should see his OPD. You should go for the clinical rounds, and you should see his class. He doesn't take one small piece of paper and he gives lecture for 3 hours. At Shilpa Shri, who is sitting here, she is telling yes, yes, like this. So the students of Kiran Gowda are really fortunate. In this small gap of 1.5 or 2 hours, he cannot tell whatever is there in his brain. He has to make it palatable and see that the time constraint is met. Now, when asked by the organizer to speak, I told I'll leave me alone, but they pressed me. I'm just giving एक चम्मच उधर से एक चम्मच इधर से, बस उस खाना को स्वादिष्ट बनाना है. वो तो अस्वादिष्ट करना है, टॉपिक स्वादिष्ट नहीं और बनाना है. Whether this grey Vamana, is it a practical thing or a bogus thing? One question is going to arise. In Mysore Government College, one book is there, Jataka Stories. In that, I'm telling one small thing. Gautama Buddha was administered grey Virechana. And the doctor told to smell the flower for 29 times. But we wanted Virechana for 30 times, but he asked the Gautama Buddha to smell it back for 29 times. It is recorded history. Gautama Buddha was given Vamana, Virechana. Then Shishya asked, Sir, एक बार जो स्मेल लेने से एक बार विरेचन होता है, आपने 29 टाइम्स क्यों बताया? वो बोल रहे भाई, भगवान बुद्ध को गर्म पानी से स्नान करने से और 30th वेग हो जाएगा. 10, 20, 30 are concerned with Virechana. We want 30 Vegas. And 30th Vega, we need not smell. If you take hot water bath, Virechana is going to take it. So, hot water bath giving on Virechana Vega was calculated during Buddha's time. So, this is all not a bogus story of grey Vamana, grey Virechana. They are practical. Otherwise, that should not enter this Jatakatas. One question is going to arise, why all this Prastha, 13.5 Palas, Sarda, Palam, all madness, I feel like. They could have directly told another word. Vamana Ukta Prastha, Vamana Ukta Virechana, Shonita Mukshana Ukta Prastha. Prastha is different there, Prastha is different here. All this is called as a big circus. There is a secret behind it. Secret is, if Ayurveda goes into some person's hands who is not learned the techniques from the Guru, he may misunderstand things. So they kept some secrets. In other contexts, it is different. In Vamana Virechana Basti, Sarda Trayodasha Pala is the Prastha. It's one answer. About 100 answers are there. But PG students and postgraduate students and PhD students should take big microscopes and see each and every word. I'll just give one example. I have got 100 answers, but I don't want to go behind answers. Okay, we did Vamana camp in Ganapati Sachidananda Ashrama, maybe some 40 years back. That Ishwared was doing Navi Pidana. Why he is doing Navi Pidana? Go back to Ashtanga Hridaya. He is telling when Navi Pidana is done, Vamana Vega becomes faster. Go back to the shlokas, go back to the commentaries and see these things. Okay, one Veda Mukandan is a very, very big specialist of mantras, of aksharas. Very big international giant. I went to him and asked, in Vamana Prayoga, some mantra has been told by our acharyas. What is the significance of this mantra? He listened to mantra, he is telling, it is that Venumukandan Vacha, not Dr. Anjay Murthy Vacha. Venumukandan Vacha, reverse peristalsis is going to happen by this mantra. Now, like MD students, PhD students, whoever is hearing, if a Vaivasi question is asked, any question be asked during Vaivasi, you tell, Venumukandan has told that by this mantra, the reverse peristalsis is going to take place. Okay. Now, what you have understood of Kiran Gowda sir's lecture is like a holige. Before preparing holige, a lot of preparations are there. He has collected a lot of knowledge from Ishwarati and other particular people, and he has given you. What you should do is take back, study these things, and come to the conclusion. So, you are very fortunate to hear like Kiran Gowda's lecture. You also should become like Kiran Gowda. He has given an example of a Kashmir student who is finding it difficult to do Vamana. In Ayurvedic textbooks, they have mentioned Kritrima Guna Upadhanina. Whatever be the outside weather, you can do Kritrima Guna Upadhanina. I don't want to go behind it. Moisture, temperature, everything can be controlled by the artificial methods and get it all right. Okay, now in Ayoga, Hrutka Vishuddhir Guru Gatrata, I have done so many Vamana cases, very, very typical. You'll find this particular Hrutka Vishuddhir Gatrata. Again, in Chaddi, Nirodha Lakshanas, Vamana has been indicated. Very, very good things are there. Our mind should try to match what is happening in the Nigraha and what is happening in Vamana Ayo Lakshanas. Okay, one question was asked about Adi Yoga again. Acharyas have very clearly mentioned Nissesha Dosha Shodhana should not be done. If you remove the complete doshas, dosha ashayas may get affected. Some years back, Rashtriya Ayurveda Pita people conducted this type of seminars, and luckily I was one of the participants in this offline session. Dr. Sridhar Kasture also was there, and that has been published as a Panchakarma manual from the RUA people. Now, what this Taranatha College people is going beyond this particular things. Now, this permanent record will be a model for the future students to understand things. And I want to congratulate the persons who are asking questions. See, when we ask questions with obedience, with politeness, with gentleness, the answers will come automatically. The person who is asking questions is asking in a very polite manner, gentlemanly manner. I thank Dr. Santosh Adalli for training the students to ask the questions. So why are you congratulating the students means if you ask in an impolite manner, even if you know the answer, they'll tell this fellow is a Shishya is Ayogya, we should not give knowledge. But when you ask with politeness, that teacher will spontaneously do these particular things. Now, one interesting that I have observed is when you're doing Vamana, and suddenly fishy smell comes in the Vamana room. Why does the fishy smell come? That is the exact Lakshana of the Pitta is coming by this color, by the smell, and other things. You can do this. One doctor, my student, Dr. Krishna Prakash, has done Vamana with Tamra in Jamnagar. But talking of Madanfal and other things, in the Rashastra Granthas, Tamra Vamana has been indicated. You kindly go and study these particular things. Okay, 1 ounce of practice is better than 1 ton of theory. Now, Kiran Goud sir has given you tons of practice. So now you multiply this tons of practice, how much theory it will become. In a distillation form, he has given these particular things. You should do. Okay, you will think, like, again, I'm telling, what does MD student, what does PhD student tell? PhD student, post-PhD students should go beyond Charaka Swishtabhata. What is going beyond Charaka Swishtabhata? So far in Charaka Swishtabhata and all places, they have mentioned about morning and evening. Sharangura is mentioning Trividha Anakara. Now, question is, people are now accustomed to Anakala. Now, my question is, don't just hang yourself to Charaka Swishtabhata, go to Sharangara and see why he is mentioning Trividha. Okay. A parallel in Kunjal Kriya, again, these Vamana procedures are there, very simple Vamana procedures. I just want to bring that back here. The Shishya is asking one question, where this Kunjal is to be done. He is telling Kunjal should be done in Kapha Meda Pradhanya Vastha. Look at the comparison of Ayurveda, look at the comparison of Yoga, Kapha Meda Vastha. Then again, Shishya asks, okay, look at the question and answers. Sir, in a Swastha person, Kapha Meda is not more, why you should do Vamana? The Guru is answering, Visesha Gunandaitvat. Now, in a Swastha person, we do Vamana, Visesha Guna is going to happen. Okay, so in the our students will ask, what will happen, sir? What will happen with these things? Whatever endocrine situations are there outside, in the GI tract, endocrine switches are there. That switches can get on and off, can be modulated by this Vamana. Now, CFTRA, Central Food Technology Research Institute, has conducted on international seminars on biomes. The full GI tract has got Sahaja Krimi. Vimshati Krimi, we know, which are pathological, but non-pathological Sahaja Krimis are there. In different diseases, these biomes are there, and they have proved in diabetes and other places, some typical nature of biomes are essential. And by monitoring, by manipulating these biomes, we can do different things. Some studies have to be done, and then we can do the particular things. Again, Kiran Goud is talking about tomatoes and keeping in proper environment. My friend Ramakrishna of Defense Food Research Laboratory has developed a Krishi Kavach. If you keep these tomatoes in Krishi Kavach, they can be kept for 15 days. Similarly, that type of examples are there. Now, one question is going to arise, Antiki Shuddhi, Maniki Shuddhi, Vaigiki Shuddhi, Laingiki Shuddhi. Which is the best? Commentaries are there mentioning Laingiki Shuddhi Reva Shuddhi. No compromise behind these things. Laingiki Shuddhi Reva Shuddhi. Then, avoid up all these things to know for the Pravara, Madhyama, Avara Shuddhi, this type of 648 have been told. Okay. Again, in Jamnagar, when research has been done, we tell Navajara, do we have any medicines for Jara? In Navajara, Vamana is indicated, and in Navajara, Vamana has been done. By morning, do Vamana, the person is becoming all right. Please refer this thesis of Jamnagar. Then, in Hyderabad, they have done a wonderful research again. It is called as Lagu Vamana. I'm not the author of this Lagu Vamana. I'm just quoting the researches conducted in Hyderabad. What they have done in Amashya Varanas, they're using this Varana to Kashaya through the rails tube and removing it out. By doing that, they're calling it as Lagu Vamana, and it is giving good results. You want to accept it, accept it. If you don't want to accept it, don't accept it. But this research has been done in Vamana, and we should know about it. Okay, now look at this Madanaphala quantities. Antarnaka Mushti. What is this greatness about this? For that individual, what is the dose? Not 1 thala, not 2 thalas. When this person-specific dose has been told. Now, please see whether we should worship with garlands, roses, or how we should worship this acharyas. Please look at this. Then I have found a practical difficulties and difference in after doing Kapha conditions, Kulata is more good. It will be giving the good results. Okay, now again Rudroga, he's mentioning Karyam Akaryam Sat. I don't want to go behind this shloka. Rudroga generally Vamana is not indicated, but in Kafaja Rudroga, Vamana is indicated. So Dr. G.K. Dave, who was the director of Gujarat State and who has done a wonderful research on the Brahmana Basti, he was mentioning we should not have Panchakarma department, we should have Vamana department separately. We should have Vedeshana department, we should have Basti department. Similarly, these people have thought of Vamana. I hope that someday a separate session will be there, like Vamana department, Vedeshana department, that will come, and Tarnath College will set an example for this particular aspects. Jai Tarnath, Jai Kiran Gowda, Jai Ishwarji. Thank you.
Thank you, sir. Thank you, Dr. Anjanaya Murthy, sir. We are truly fortunate to have you with us and are grateful to your valuable insights and knowledge. Thank you, sir, for your guidance and inspiration. On the occasion of Suvarna Sambrama, the Department of Panchakarma, Tarnath Government Ayurveda Medical College and Hospital, Ballari, proudly present the first of its kind state-level debate competition on Basti, Ardha Chikitsa versus Purna Chikitsa, an innovative academic initiative bringing together postgraduate scholars of Panchakarma from 28 colleges across the state to debate on the most significant concept in Panchakarma on 23 July at 11 a.m. Live streaming is available. Join us for this unique intellectual event and witness scholarly discussion that celebrate the spirit of Ayurveda and academic excellence. As we come to the end of the session, I warmly invite Dr. Shilpa Shri ma'am to deliver vote of thanks.
Good afternoon, sir, and everyone. I am very much delighted to deliver the vote of thanks for today's enlightening webinar on therapeutic potential of Vamana Karma, a clinical approach, conducted under the webinar series Karma Chintana, organized by Department of PG Studies in Panchakarma, Tarnath Government Ayurvedic Medical College, Ballari, on the occasion of Suvarna Sambrama. First and foremost, I express my heartfelt gratitude to my guru, mentor, and guide, and our esteemed resource person, Dr. Kiran Gowda sir, for delivering such an insightful, informative, and inspiring session with fruitful question and answer session. Thank you very much, sir, for sparing your valuable time and sharing your expertise with us. Thank you very much, sir. And our sincere thanks to our respected principal, Dr. Janaki Y.S. Madam, for her constant encouragement and support. Thank you, ma'am. And I extend my special thanks to my guru, Dr. Anjanaya Murthy, sir, for your presence and thoughtful words. Thank you, sir. Thank you so much. And I extend my gratitude to our respected HOD, Dr. Santosh Edalli, sir, for organizing this meaningful webinar series. I sincerely thanks Dr. Rashekar Gandhir, sir, HOD, Professor, Department of Dravaguna, for his constant support. Thank you, sir. And I sincerely thank faculty members, organizing committee, technical team, and all participants for their wholehearted support and active participation, which made this session a grand success. Thank you all for joining us. We look forward to welcoming you again to our future academic programs. Thank you so much.